Hello, everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin, Cape Town, South Africa. Just a quick disclaimer. The information that is provided in this program is to assist you in exploring all available options, to empower you to make well-informed decisions, to help you feel in control, be responsible for, and have confidence in your choices. So information should please not be substituted for the diagnosis and treatment of any medical condition. And also please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is also not intended to replace professional or medical or other kinds of advice. So in this recording, we will be looking at the basics of how breastfeeding works. So when we talk about how breastfeeding works, we should probably also be discussing baby's attachment and latch and baby suckling and the mother and baby's positioning and the mother's milk supply and management of breastfeeding and some other things as well. But this will make this recording too long. So please see separate recordings on each of these. So what do you think? What is successful breastfeeding? And there are no right or wrong answers. It's just at the end of the day, each family needs to decide for themselves what they see as successful breastfeeding. Because it could be breastfeeding a baby exclusively, it could be breastfeeding and giving top ups, it could be exclusively expressing and giving the baby the expressed milk. The point is, parents need to define their own success. Here are, however, some elements to facilitate exclusive breastfeeding and to help you reach your breastfeeding goals. And it includes a little bit of planning, a lot of milk, and lots of milk is dependent on various factors, and I will show you this in the next slide. And you will also need a deep and comfortable latch from baby, which we will discuss in a recording on baby's attachment. And we need maternal confidence, and maternal confidence is influenced by your personal experience, your personal expectations, your self-perception, feedback from others, a supportive environment, being satisfied with the birth experience, etc. And all of these need to be in a bowl of support. So make sure you choose your support system well. And perhaps also educate your support system. Okay, so for lots of milk, we need enough milk making tissue and intact nerve pathways and ducts. So we need a functioning anatomy. We also need adequate hormone and hormone receptors. So we need functioning physiology. And these are primary. This is what we start with. And then with regards to the secondary or indirect influences on milk supply, we need adequate lactation critical nutrients, which we will also discuss in a future recording. We need adequate, frequent, effective milk removal and stimulation. This is the management of breastfeeding in the green area. And the mother and the baby are role players here. So from the mother's side is how long is uh, is the feed, how often does she feed her baby, how does she bring her baby to the breast, etc. And from the baby's side is what is the baby's ability to remove the milk effectively. And then lastly, that we have identified so far is no other lactation inhibitors. So, for example, what is the effect of medication on the milk supply? Things like too much parsley, too much sage, too much rosemary, too much thyme. That sounds like a Simon and Garfunkel song. Also, too much peppermint. And then when we add all of these elements together, then we have the potential for a good milk supply. So basically, for breastfeeding to be biologically successful, it is essential for the baby to remove adequate amounts of milk from the breast to ensure that the baby gets enough to grow as expected, and also that the breast is stimulated enough to continue milk production. So keep in mind, and we will discuss this in the recording on positioning, that whatever the mother and baby's position is, the effectiveness of all breastfeeding techniques can be judged by two criteria. Is the mother and baby comfortable during the feed? And is the baby removing the milk effectively? And this we will see in baby's weight gain. So the cornerstone of breastfeeding is comfortable positioning for mother and baby and a deep and comfortable latch, and the baby sucking effectively to get the milk that they need. So when there are any issues like breast or nipple pain or milk supply problems or weight gain issues or a difficult baby, we start by looking at mum and baby's position and baby's latch and baby's suckling. And I will mention this again in a future recording. So as mentioned, we will be looking at latch and suckling and positioning in recordings to come. But just to point out, positioning influences the way the baby latches, which influences the way the baby suckles, which influence the effectiveness and comfort of milk transfer. So how much milk the baby gets with what degree of effort. So there are quite a few factors that play a role in comfortable and effective feeding. So what happens if the baby is ineffectively positioned or latched or suckling ineffectively? Well, sometimes there's pain, sometimes there's nipple damage, but with ineffective positioning, latch, or suckling, there is always insufficient milk transfer. And this could lead to a reduction in the mom's milk production, baby developing ineffective sucking habits, and then possibly early weaning. So, the most common early causes of nipple soreness are actually simple and avoidable. So if babies are attached effectively and deep at the breast, most mothers do not get sore nipples. So how often do you think breastfeeding just doesn't work? So there is no easy answer because there are so many variables. Just look at what we need for exclusive breastfeeding and look at what we need for lots of milk. So when you have these, you can be pretty sure that you will reach your breastfeeding goals. Now, the most prominent breastfeeding problems reported by mothers in literature are latching difficulties, mothers having sore, wounded, cracked nipples and painful breasts, and low milk supply issues. And most breastfeeding problems can either be prevented or easily treated. And understanding the cause of the problem goes a long way in helping to fix it. So again, it usually starts with, or we start by looking at what is the mother and baby's position, what is the baby's latch looking like, what does the baby's latch look like, and also baby's suckling. And then we can start looking at other things as well, like breastfeeding management, how often the baby feeds, etc., baby's oral anatomy, etc. So breastfeeding was simple before we started making it complicated with clocks and our left brain instructions and our rules. And we are hampering the mother's innate ability to interact and learn from her baby. So please trust your baby, trust your body, and trust your instincts. Just a quick note on foremilk and hindmilk. Just look at the fat and the lactose content of mature milk at the beginning of the feed and at the end of the feed. So compare this at the beginning and at the end. Now, the lactose or milk sugar, and I've mentioned in a previous recording, um, lactose is the major carbohydrate in human milk. It sits much more at the beginning of the feed than compared to the end of the feed. So you may have heard people talk about foremilk, the more thinner, watery kind of milk, um, produced in greater amounts early in the feed, and then the hind milk, the whiter, high-fat milk produced at the end of the feed. Now, these terms, foremilk and the high milk, it makes it sound as if the breast produced two kinds of milk, but that's not the case. There is no sudden change from foremilk to hind milk. Women only make full cream milk. So the fat content increases gradually from the beginning to the end of the feed. So as the milk is made, the fat sticks to the sides of the milk-making cells, and they are flushed out gradually during an oxytocin reflex. And we'll discuss this oxytocin reflex in the recording on anatomy and physiology. Okay, so the milk baby receives at the beginning of the feed has less fat and more milk sugar or lactose. And the longer the baby feeds at the breast, the more fat and cream the baby receives. So I hope you can see from this that it is important to give a baby a full feed and allow the baby to suckle as long as the baby is on one side before offering the other side. Now, I'm not saying the baby may only feed one breast per feed, but that the baby doesn't necessarily have to feed both breasts at each feed. It depends on the baby, depends on the amount of milk in the breast and various other factors as well. So when a baby has both the watery milk and the high-fat milk, they get a complete meal, including all the water that they need. So if a baby is offered the second breast too soon, for example, after a set amount of minutes, and not allowed to get to the fat milk on the first breast, it's like eating at a restaurant and you are still busy with your soup, and then the waiter brings you another bowl of soup. Now, soup is great and nutritious and all, but it doesn't fill you up. And it doesn't have a lot of fat and calories. So this might also be the reason why a baby who is switched too quickly to the second breast might be hungry all the time. The baby might not be gaining weight as expected. The baby might be weeing a lot, not have a lot of poo nappies, because poo is digested high-fat milk the baby didn't use. The bottom line is let the baby finish on one side before offering the other side so the baby can get their full 3-course meal. And thank you for watching this recording. In the next recording, we will be looking at anatomy and physiology, because understanding anatomy and physiology may help prevent and treat possible problems. Please visit the breastfeeding clinic at www.breastfeedingsa.co.za if you would like to book a private consultation and also receive the breastfeeding class notes. And you can also navigate the class recordings easier from the website. And please feel free to subscribe to this channel for more breastfeeding class recordings. And take care till next time.